Good evening to Dr. Raza, and my name is Boniface Basik, anak Mukine with number metric 82396. My topic for today for WEKA assignments is health and well-being clustering analysis using WEKA, a study on diabetes, breast cancer, and student mental health. For introductions, clustering in data science is a technique in a machine learning for grouping similar rows in datasets, which is crucial for discovering natural groupings in data mining. In applications while used in various domains like healthcare, education, and etc., and uncover hidden patterns in insights and guides decision-making and intervention strategies. In my project's focus is to analyze three datasets, which is diabetes, breast cancer, and student mental health. And this datasets is sourced from Kaggle and UCI Machine Learning Repository. For problem statements is the reveal underlying patterns for a better healthcare and education insights that diabetes identify patients, clusters, and breast cancer is to categorize the diagnostic features, student mental health to identify at-risk groups for a better interventions. And for motivation is the reason why I choose this topic is to uncover hidden patterns in data for impactful improvement in healthcare and educations, to provide insights for a better decision making and enhance our healthcare outcomes, and advance data-driven decisions in healthcare and educational sectors. Now we move to datasets descriptions. For first dataset is diabetes datasets. Diabetes is a chronic metabolic disease that characterized by elevated levels of blood glucose or of blood sugar, which leads over time to serious damage to heart, blood vessels, eyes, kidney, and nerve. Like the most common cause of diabetes is caused by several factors such as the overweight, obesity, and physical inactivities. Like when people are not active doing a physical activity during their leisure times, the extra weight sometimes causes insulin resistance, and that's why we need to develop a fit body to make our body mass index, which is BMI, to normal to prevent this disease. So in this data, which found in Kaggle, there's a 7 attributes in this data such as glucose, blood pressure, skin thickness, insulin, body mass index, BMI, and diabetes predictory functions. The last one is age. The move to the datasets, my second datasets, which is breast cancer datasets. Breast cancer is an abnormal growth of tissue in the breast that can sometimes be felt as a lump. From breast cancer symptoms and causes, Mount Elizabeth Hospitals said that the tumor can develop when our cells in the breast divide without control and provide extra tissues. The data that taken from Kaggle have a 10 attributes, which is attributes in age, menopause, tumor size, invitation notes, notes caps, breast quad, which is where the position of tumor is. For example, left of breast, top at breast, at the bottom of our breast, and the right of our breast, irradiate, and the class. And my last dataset, which is students' mental health datasets. Mental health includes our emotions, physical and social well-being, and it affects how we think, feel, and so on. It also helps determine how we handle stress, relate to others, and make healthy choice. From CDC 2021, like every student might have this one kind of phase of them where they are having a mental health breakdown. Like this is crucial for students to aware of themselves about their own mental health. And in this students' mental health datasets, there is 8 attributes that being shown, such as the gender, age, current year of study, like what is your GPA, do you have depressions, do you have anxiety, do you have panic attack, and last one, did you seek any specialist treatment? Click tools and click files open to search our data in the one that we already downloaded from Kaggle and UCI. Make sure that we click CVS data files so that the data is shown in the WEKA. Now we click data WEKA and choose our data, which is my data diabetes. And after that, here's the data that already downloaded. Click files and save as. Now we need to choose file of type, which is ARFF data, and edit the file name to diabetes ARFF format. After that, we click save. Now the data is already in ARFF format. Click exit to close the window. Now we want to clean our data, which is pre-processing. Click Explorer and then open file and choose data that we change the ARFF format just now, which is my data diabetes. Click diabetes and open. Here's the data that in the data, which is click all to filter the data, which is how we clean the data. In instance, remove duplicates and click apply. Now we click all again, choose, go to attribute and find a replace missing value, because some of the data have a missing value, and click apply. Now we check one by one the data, is everything okay. Now if the no missings, then we can proceed it to the next. Now we also can remove the attributes in the data, which is the outcomes. We can remove the parentheses, we can remove. And then if we want to undo back the delete, we can click the undo button and the parenthesis is already there again. After the data cleaning, we go to the clusters algorithms, which is the k-means, the density, and hierarchy. We can change our nums of cluster to 3, 4, or 5, but here I choose 2 and click start. Here's all the clusters output, and we also can visualize clusters assignments, which is we can see the visual of our data, and here we change the color to clusters and x-axis to glucose. And also there's a lot of that we want to pair, so such as we want to pair age. In here we want to pair glucose and BMI. After that, in here we can view full of our scatter plots, which is the delta. We want to see how big the clusters is, and here is we can choose any of our colors that we want to match, and then click update after all the things that we change, and we can view one by one. And yeah, here does the scatter plot outcome. Now we choose to make density based clusters. Here we can also change the debug, do not, and we click start and visualize for it's same with the first one, the first data set that we done. And here there's a lot of X. So we change clusters so that it will automatically divide. And here we have clusters X, and Y is BMI, which is body mass index, and the color is clusters. And here's the outcome of the scatter plot of our clusters. Now we change to hierarchical clusters, which is click start. When the hierarchical clusters output, it takes some time to run. There's something wrong with the data sets, which is like for example here it's 8.52 seconds. Now to make it less, we change the link time to complete and number of clusters to 5, and then we click start again, and the clusters is full training data is 1 second to build the model. Now we click visualize tree for the dendrograms. click. Then we also can view the visualize of the scatter plot. For the evaluations part, which is the data sets k-means, which is the provide. Okay, skip bagian to. Okay, 1, 2, 3. For the evaluation of each data set, which is diabetes data sets, for in the scatter plot for the k-means and density-based and hierarchical clustering algorithms are in the same pattern, but each of these algorithms have a different color. Like this dataset suits for k-means, which is the diabetes is more sweet on the k-means, and in density base is more to clusters 1, and while the cluster 0 have a little bit, and the data is not even same with hierarchical. And same with hierarchical cluster time taken to build model in full training data was 6.51 seconds, and it showed that this data sets is not really suits for hierarchical, and the dendrogram at first like looks so messy, and it's changed format, and which is change the cluster and change the link type single to complete and the number of clusters from 2 to 5, and click start to show the better dendrogram. Now move to the breast cancer datasets, which is all the clustering algorithms show a similar patterns like all the and this breast cancer dataset is suitable for all clustering methods. And last dataset, which is students mental health datasets, which is a consistent pattern across clustering algorithms, is suitable and also suitable for all the clustering methods. And for the conclusion is that WEKA is used for these assignments, which is to cut. For conclusions, WEKA used for k-means, hierarchical, and density-based clusterings. For the diabetes datasets, identify distinct patient profiles. Breast cancer dataset show potential for tumor subtypes identifications. And students' mental health datasets identify at-risk group for a better support programs, and each algorithm has its strengths like k-means for a clear clusters, hierarchical for relationship, and density based for outliers. And thank you.